sir. Good morning, it's 8:30, Friday, Viva Fitness. Of course, guys, pretty sure you might have heard by now, hopefully. The United States Supreme Court blocked on Thursday, American time, the Biden administration from enforcing its sweeping vaccine or test requirements for large private companies. But the conservative majority court allowed a vaccine mandate to stand for medical facilities that take Medicare or Medicaid payments. The OSHA mandate required that workers at businesses with 100 or more employees get vaccinated or submit a negative COVID test weekly to enter the workplace. I wanted to read just a little bit of this ruling. It's a 30-page decision here, and I'm just going to read this one part. Administrative agencies are creatures of statute. They accordingly possess only the authority that Congress has provided. The Secretary has ordered 84 million Americans to either obtain a COVID-19 vaccine or undergo weekly medical testing at their own expense. This is no everyday exercise of federal power. It is instead a significant encroachment into the lives and health of a vast number of employees. We expect Congress to speak clearly when authorizing an agency to exercise powers of vast economic and political significance. There can be little doubt that OSHA's mandate qualifies as an exercise of such authority. So we'll go ahead and, can we post this ruling up? Or a link to it or something? Dr. Hoa, what does that mean locally, though? Because the Gov has her vaccine mandate in play.
I think that locally we still have to follow the federal guidelines. Yeah. So, companies over 100 people, will no longer be mandate the employee to get vaccinated. I think again, from what I stand from the beginning is that, the government can mandate whatever they want with the government staff, but for the private employer, it should be their choice to make the decision, and the government cannot, mandate or interfere with private business on the vaccine. They can encourage the employer to ask the employee to be vaccinated, but I think that for the government to mandate the employer to have the employee vaccinated, to me, again, from day one, I say that it's kind of violate the freedom of choice for the patient and for the people. So that's why I stand from the beginning. I will stand firm with what I believe. So it's good for our people to be able to make their choice. You can educate them about the benefit of the vaccine. But you have to leave the people their choice of getting the vaccine or not getting the vaccine.
Yeah, there's a part in the ruling, Doc, where it talked about where COVID is spread, and it was saying something like it's not really happening in the workplace, and where it does spread is at home and in gatherings and all that. I thought that was interesting. But, I brought you on, Doc, because the Physicians Advisory Group chair, Dr. Nathaniel Berg, he did a long interview with Nestor Lecanto yesterday. And I know you caught that interview. I felt it was the takeaway I got from it was that there's no new restrictions in place, and that Dr. Berg had kind of made the argument that we're going to see 400, 500, even 600 positive cases, he had said, but he felt it was going to be okay, and that with a little luck, we would be out of the surge by February 1st. And so let's just go in and your response to the interview and the comments that Dr. Berg has made.
I'm still very much worried just because I tell you, I think Dr. Berg, and the rest of people that say some on the radio is that, department, none of them really take care of COVID patients. They really need to be candid for that. As a primary care physician, we see sick patients and we take care of sick patients. I think that I totally agree that Omicron have milder symptoms than the Delta, and the chance that you end up in the hospital is much less. But you have to worry about the long-term effect of having infection from COVID, right? For example, the long COVID syndrome that we hardly talk about, and we see those patients in our clinic, and they're miserable. They recover from the symptom, from the infection fine at the beginning, okay, but when they recover a few weeks or a few months later, they have shortness of breath that progressively getting worse, and that might be a lifelong symptom. We have two pulmonologists on island, okay, Dr. San Augustine at GMC and Dr. Julie Nagan, and their schedule for long COVID syndrome is about 3 to 4 months out. Wow. So we have to worry about this population that get infected. So I think that to let the infection run without any restriction, we're not talking about lockdown. This is impossible to lock down. It's not the thing that we worry about. We should never lock down anymore, but we should have some restriction on the gathering, just because we know now that the infection is not so much on any workplace at this point. It's through all the gathering. Again, the rosary, the wedding, the family gathering, and those are the infection coming from at this point. And you don't need to have data. That's what we tell you from the clinic. So I think that put some restriction on the number of gathering should be the control factor to make sure that we don't have a big number of positive in the community. And I think if you do that, our people will listen, but I don't see how you can do a control positive when you have no restriction at all. So I think that if we're going to let the positive run the way they are right now, we're going to encounter a lot of problems in the long run. So as you can see, business are having impact because they lose their employee for anywhere from 5 to 7 days or 10 days. Again, some few people are going to get sick. And one thing that I'm very surprised, and I hope it's not going to come to on the island, is that in the state, Omicron tend to affect the children more than adults. And quite a few places they see that children admission to the hospital are getting higher. But so far, we have not affected our children yet. So I keep my finger crossed that it will not, but it will wait to be seen for the next few weeks or so to see if the number of positive children going up, and along with admission to the hospital.
Doc, I think that's so interesting because Dr. Berb in that interview said that the Omicron doesn't really affect kids. So it's very
No. I beg that for difference. So Omicron does affect children much more than any variant in the past. So, that's something we need to realize, man. That's the part where we have to be careful, right? Our children is the future of Guam, and this is where we need to really protect our children. Like I say, it doesn't see that in Guam yet for Omicron, but again, we're just at the beginning, so we have not seen anything yet. So we hope and keep our finger crossed that it doesn't happen to our children.
We did have Dr. Berg says, I have friends who do not want to get vaccinated. I have friends who don't want their kids to get vaccinated. And I tell them, if you're going to do that, just be extra careful because you're vulnerable to kids, probably not from Omicron so much, is what he said. But down the road, you may want to consider getting it down the road.
Yeah, we should be able to get the thing. And we have to kind of set the story straight on the vaccine and the booster, right? The vaccine, the booster, does not prevent you from having infection of COVID if you drop and you don't practice the 3W. Okay, that's very important to know. Okay, so getting the vaccine, getting the booster, you have to practice the 3W to prevent you from getting COVID. The only thing that the vaccine and the booster does is it try its best to keep your severity of the infection down, so you don't end up in a hospital. Okay, so that's what we have to make a difference. I heard somewhere that will say that if you get the vaccine, then it cut the risk of you getting sick and not seeing the clinic. That's the clinic. We get bombed with people that are fully vaccinated and still get sick. So still we need to pass the message correctly. So everyone, vax or unvaxxed, need to practice 3W and try their best to not go to gatherings so they don't get sick. So that's the most important thing. And I think that it's important for people to know that all the positive we have out there, who's vaccinated, fully vaccinated, partial vaccinated, or boosted. Because I think it's important to pass the message. But if we don't say that, the fully vaccinated, the boosted personnel, they go out there and they drop the 3W, and our infection rate will continue to go up. To still see a lot of large gathering that planned in the next week or so. And I tell you, whoever put those plans together for the large gathering, they really need to be responsible, because you don't want one of the attendees to come down and end up in the hospital. That's really, you feel responsible for that.
Doc, public health, it doesn't seem like they're doing contact tracing anymore. So I heard about a wedding that was a spreader event.
Yeah, it's kind of hard to do, contact tracing, because they really limited amount of manpower. And when you have this 500 positive, it's impossible to do the contact tracing on all of them. Maybe they lucky they do a quarter of that because of manpower. So to me, I think that what they concentrate on some many events that have the super spreader, that they concentrate on those, but not on everyone that will be positive. So again, it's going to hit home, it's going to hit the workplace, and the business will feel the impact on missing the employee in the next few weeks. Again, I know they shortened up the isolation now from 10 days to 5 days. But they're still going to miss some employee at the workplace. And again, I hope that when they clear people to go back to work after 5 days, that they actually talk to people, make sure that the symptom improves before they clear them, because they don't want to send the employee back to work when they're still sick, and then there's a possibility they're still infectious.
Doc, I mean, I know I'm not a doctor, Jason isn't, Joe Sir, most of the people on Guam are not, but it just seems, and maybe you can explain the decision making behind it, because you were in the PAG, but it just seems irresponsible to adopt this policy as a policy to just let the cases run and to rack up these crazy case counts with no mitigating effort. I mean, they could easily drop the gathering limits down or whatever, but it does seem irresponsible. And if I was a frontliner at the hospital, I'd be very concerned seeing 400, 500, 300. I mean, it's normal, right? We've seen double digits and high double digits. And so is it responsible for the PAG and the governor to just adopt this idea that the cases are going to run and let it run? Because that's kind of what's happening.
Yeah, I think that I'm not sure if the word responsibility there, but I tell you that they need to take into consideration about the hospital, right? I keep seeing that the hospital is not ICU and is low in number. But again, they need to talk to GMH and the GRMC. That's the people that are really taking care of the COVID patient and non-COVID patient. And I know, talking to them, they are tired, and they really don't want to have the double-digit number of COVID patients in the hospital, because that creates a lot of work for them, a lot of risk for them, and also take away from the care for the non-COVID patient. So I think that they really need to look at the stuff, the people that make the decision, they need to involve in the people from the hospital. We haven't heard anything from the two hospitals yet, and those are the ones that we really need to hear from, just because they are the one that really get affected. It's not us. The clinic we see, we got affected, we got tired, but the hospital getting worse. So decision need to make by not look at those number, but talk to people that do the work and not just look at the number.
Yeah.
And to me, they should rethink of put some restriction on the gathering. It's not a lockdown. There's no lockdown here, but I think the restriction on the gathering will kind of curtail and help ease off the positivity at this point. We cannot go on this rate and let it burn out by itself. But I tell you, this is it's not a good idea.
And I'd only say irresponsible, Doc, because going back to the Delta surge, I mean, we're right in the same place we were with Delta, except the cases are higher, but we're the same place, meaning you're here on the link. You're saying, why aren't we doing anything? With Delta, it was, I mean, God, we didn't hear from the governor for weeks, right? And meanwhile, the DOAs were piling up, the cases were crazy, the hospitalizations were, and so I just want to make sure that, because I feel the deja vu, that we're right back where we were at the beginning of the Delta surge, and I'm worried, man. I'm worried because I hate it when you're right, first of all, and it just seems like that's the play. I mean, it was pretty clear that they're not going to do any, and I think it's also a little tricky for Dr. Berg and his rhetoric when he does these interviews. He really likes to go from zero to lockdown. So he presents these options that are, it's like, oh, well, if you guys, nobody wants a lockdown. Well, nobody's saying a lockdown. They're just saying do some kind of restriction, like you said, limit the gathering. So, and I feel like when he goes zero to lockdown, it really presents only two options to the people, which is keep on doing what they're doing and totally lock it down, right? And of course, nobody wants a lockdown. I know you don't even think that'll work.
No, the lockdown is way out. There's no one ever think, including myself. I think that some restriction, the gathering, that's the main thing. And people won't fight restriction, because they know that's where the gathering is all about. But it helped guide them on this decision of, put the gathering and the celebration, the rosy together. So I think that some type of restriction should be good. But again, even 100 outdoor gathering, just like the past, the recent wedding outdoor, they all get infected. That's the problem, is that if we don't put a restriction, a smaller number, we will continue to see this possible all the time. So it's very important to know that. The other one I want to address that yes, they count the positive admission that go in there with a heart attack and a stroke. Yes, they should count them. And the answer to that is not because we don't want to underreport the COVID infection, but people got to know, and this is people who practice medicine and not going to count the number, is that, COVID infection is totally different than influenza, like the flu and the foreign infection, is that it creates a microembolism that create clots, okay? And the clots cause heart attack and stroke. And that's why when you admit it, people that even not having this chronic comorbidity, they have a stroke and heart attack because those microembolisms that create by the COVID infection. So yes, you have to count them because more likely the COVID infection exacerbate the comorbidity and get them to have those advantages and have them admit to the hospital. So, you have to understand that that's the reason why when you admit for a heart attack or stroke, they test you because they need to know if those exacerbate the symptom or not. And that's what that's what the etiology for the long COVID syndrome was, the lung problem, because yes, those microembolisms affect your lung and cause you to have shortness of breath. So yeah, this virus is amazing. So we have to pay attention to those things and get the right message out rather than have a mixed message. So just people to kind of limit their gathering and just be responsible. I think and past the 3W, vax or no vax, you should be the 3W and treat the same.
Doc, what you just said, I think that was really crucial because people talk a lot about that. And I think Dr. Berg had also talked about that in saying that, yeah, people go to the hospital and we test them for COVID, but they're in for something else. But that was so basic what you just said. You test them for COVID because if you're getting admitted for like heart trouble and they test you for COVID and you have COVID, that means that your whole treatment totally changes because you have the virus, right? That's basically what you're saying.
Yes, it's very, and you had to be careful because if you look at the record for admission, right, every one of them were placed in some type of blood thinner just because the microembolism will exacerbate them. You might not have kidney problem, but when you get admitted, you might have kidney failure. So you might have a heart attack just because the microembolism occur during those infections. So you have to know in order to provide the appropriate treatment for the patient.
Doc, during the Delta surge, when the governor's office wasn't really doing anything and they were letting the virus run rampant, right, and the bodies were piling up, we saw the businesses, rather than react, they were proactive and they placed restrictions on themselves. Do you think that we're going to see that again as we get deeper in this Omicron surge?
I was hoping that they do. I mean, like, again, it's not a lockdown, okay? It's some restriction for the number of gathering. I think it's important to do that, to me, I don't know if they're going to do that or not, but I hope and I wish that they do. I think there's not much complaint on the restriction, though. No, in a restaurant, with 100%, restaurant require you to wear masks when you come in, and the only time that you take the mask off when you eat. So it's kind of a controlled environment. But when you have unrestricted gathering and you have no mask control, that's where the super spreader is all about. And and we will continue to have long line of tests and a whole bunch of positive if we don't put the restriction together. And yes, it will burn out. And it's going to take a while, and when people will get affected, either physically or business-wise, they will get affected.
But Dr. Berg said February 1st.
It's not going to be February 1st. So it's it's going to be for at least several weeks. So if we're lucky, it doesn't last as long as the last one, but I don't know if it's going to be at least from 4 to 8 weeks out there. But February 1st is I'm most likely it's not going to happen.
Doc, I wanted to get your reaction. Can we pop that up? So, public health, they switched the appointment-based testing, and we've just been getting so many complaints about people not getting the results, people having to line up for the walk-ins. And so I don't know if you saw this, but my boy Jay here tried to book testing for today and tomorrow, and it's sold out today. It's sold out tomorrow. It was sold out yesterday. We're going to a 3-day weekend. Martin Luther King Jr. Monday, holiday. I hate to keep asking you the same damn question, but do we need to be doing more to get our people tested for the 80 millionth time?
Yeah, they should have more than one testing site. I think that they should not just have the appointment. Appointment can be from different things, right? Can be from close contact, can be from mandate from the employer for you to get tested. So when you do the appointment, you take away the real sick visit. So I think that they should have a testing site somewhere that if you feel any symptom, that you go there, because you gotta prioritize those patients, because that's the one that most likely will be positive, right? So they should have an approach in a totally different way rather than lump sum everyone into one place, and you kind of might lose the symptomatic patient that cannot have the appointment. So just like you say, today's old book. So what happened to the rest of people that might be symptomatic that can't get in? And and the more the delay that you have to identify them positive, and they're going to walk around and spread the virus further. So if you have 400 and something yesterday, for everyone that positive yesterday, there'll be at least I'm confident about 2 or 3 more out there that positive that not been tested, and it's going to grow like like crazy exponentially if you don't catch those 2 or 3 that have not tested yesterday.
Doc, can we talk a little bit about the long COVID? This is a condition where people have got COVID, right? And I mean, you had mentioned even very athletic and fit people, they catch COVID, but they continue to suffer negative effects from that infection. I mean, months, year down the road, right?
Yes, and it doesn't happen. It's a small subpopulation that people don't have the long COVID syndrome. Again, even after the infection, you continue to create this microembolism that cause liver clots that might affect your lung, your kidney, and your heart. So people come in from the most common is they have shortness of breath. They walk just a few steps and they cannot breathe. That's it's a long lasting symptom that you're going to have. And again, you have 2 pulmonologists on island, one at GMC and one in our clinic, and their waiting period is about 3 to 4 months before we can get in there and see them. And it's not a good thing. We have to know that, because those people almost disabled by the time they get that, and it's very sad to see young people that have very mild symptoms and recover from COVID, and suddenly they come in a few weeks later and say, "Doctor, I can't walk. Every time I try to do something, I cannot breathe." It's a long workup, but we have limited specialists on the island to see them.
Doc, and so you're seeing a lot of these cases of long COVID?
Yes, we see a lot of these cases in our clinic. And again, they are waiting in line to be seen by the pulmonologist. And in certain cases, when people have other comorbidity, that the condition gets worse, we have to call and kind of ask a favor from the pulmonologist to see if they can see the patient sooner rather than wait for 3 to 4 months.
Oh, goodness. Yeah, this guidance, Doc, I know the CDC. I saw this skit. There was this comedian. He did a skit on the CDC guidance, and he said CDC stands for changing decisions constantly, right? So now...
No, they have the purpose. They written somewhat.
I wanted to ask you about this one, Doc, though, because this just popped up in my Google. God, and I just hope it's fake news, but I want to ask you, I don't know if you've ever heard anything about coronavirus lingering in the male sexual organ and maybe causing impotence.
Well, again, that probably stems from the microembolism that the COVID infection can create, right? So anything your eye, your sexual organ, is all about small blood vessel, right? So yeah, I mean, I don't think I heard anything about it. Right now, the only thing that we heard about.
Let me send you some links, Doc. Hold on, because I just
about the shortness of breath, and you can always use Viagra or something like that. It probably will affect.
Doc, that's the other medication you get from Pfizer.
Yeah, we're trying to promote.
People are way too much on Pfizer these days.
Yeah, Doc. I mean, I just sent you to it. There was an article. I mean, it's not the most credible news outlet, but the New York Post. They ran a story. Man claims his penis shrank 1.5 inches due to COVID, and it has what the doctors in this article are saying. There's a few. It's even on WebMD. What they were saying was, you're right. It's because the blood vessels
Yeah.
Well, you guys know the rest, right?
So again, for our people, when they get admitted to the hospital and they have a heart attack, a stroke, or whatever infection, it's important that they test for COVID, because again, that's the reason why they have to know, because the treatment is different. So it's not to kind of not undercount COVID infection, okay?
Doc, so is this going to be our next vaccine and booster campaign? You don't want your organs to shrink if you get COVID, so go out there and get I'm telling you, that would work with the guys.
Yeah.
Jay's like, can I get a booster just to be safe?
But the vaccine, the booster is very important. It does decrease the risk of severity of the symptoms. So I highly encourage people to get the booster. But again, don't forget your 3W. Okay.
Thank you, Doc.
You're welcome, guys.
Be safe. Yes, Jinx. Yes, always. Be safer, Doc. I think be safe. It's played out. People don't even hear it anymore. Let's say be safer.
And buckle up. Okay.
Buckle up for the Omicron roller coaster. Well, we're on it. It's too late. Can't get off. Things moving. Thank you, Doc. Right on. Dr. Hoa Nguyen. Yeah. Oh, I definitely don't want to catch COVID now.
Did you find that article, or did somebody send it to you?
Very funny, Jay. Very funny.
Yeah.
I saw it on Twitter. And yeah, so this
All I got to do is hit Control H and look at your browser history.
Hey, come on, man.
We're